today's procedure, I will be doing the suctioning secretions from Airways. Assessment: assess respiratory system. Note the rate, depth, rhythm of respiration. Note the noisy, wet or gargling respiration. Auscultate breath sounds. Assess client's ability to cough. Note the amount and character of sputum. Assess vital signs. Compare to baseline vital signs and note an elevation in temperature. Assess level of consciousness and ability to protect airway. Example, presence of cough reflex. Note any drainage from mouth. Equipment: sterile suction kit containing appropriate size catheter, pair of gloves, container for saline to flush and lubricate catheter, sterile saline, facial tissues, and towel. Procedure: verify the physician order and identify the client to prevent potential errors. Wash your hands. Hand washing prevents transmission of microorganisms. Good day, sir. I'm Tia Joy Arojo, your student nurse for today. And for today, I will be doing your sectioning secretions from Airways, and the purpose of this procedure: first, remove excess mucous secretions to maintain patient airway. Second, collect sputum or secretions for diagnostic testing. Position the client. Position the conscious client with an intact gag reflex in semi-Fowler position. The semi-Fowler's position helps prevent aspiration of secretions. Position the unconscious client in a side-lying position facing you. A side-lying position facilitates drainage of secretions by gravity and prevents aspiration. Turn on suction device and adjust pressure. Infants and children 50 to 75 mmHg, adults 100 to 120 mmHg. Excessive negative pressure traumatized mucosa can induce hypoxia. Open and prepare sterile suction catheter kit. Unfold sterile cap touching only the outside. Place on a bedside table. Pour sterile saline into cup. Pre-oxygenate client with 100% oxygen. Hyperinflate with manual resuscitation bag. Pre-oxygenation helps prevent hypoxia. Hyperinflation decreases atelectasis caused by suctioning. Don sterile gloves. If kit provides only one glove, place on dominant hand. Dominant hand will remain sterile. You may use a clean disposable glove on the non-dominant hand to protect yourself from exposure to mucous membranes and sputum. Pick up catheter with dominant hand. Pick up connecting tubing with non-dominant hand. The non-dominant hand is now considered clean rather than sterile. Attach catheter to tubing without contaminating sterile hand. Place catheter end into cup of saline. Test functioning of equipment by applying thumb from non-dominant hand over open port to create suction. Lubrication makes catheter insertion easier and ensures proper functioning of suction equipment. Insert catheter into trachea through artificial airway during inspiration. Advance catheter until you feel resistance. Retract catheter 1 cm before applying suction. Note: client usually will cough when catheter enters trachea. Apply suction by placing thumb of non-dominant hand over open port. Rotate the catheter with your dominant hand as you withdraw the catheter. This should take 5 to 10 seconds. Hyperoxygenate and hyperinflate using manual resuscitation bag for a full minute between subsequent suction passes. Encourage deep breathing. Rinse catheter and tubing by suctioning saline through. Repeat steps 10 to 14 until airway is clear, inviting each suctioning to 3 passes. Without applying suction, insert the catheter gently along one side of the mouth, advance to the oropharynx. Apply suction for 5 to 10 seconds as you rotate and withdraw catheter. Allow 1 to 2 minutes between passes for the client to ventilate. Encourage deep breathing. Replace oxygen if applicable. Repeat steps 16 and 17 as necessary to clear oropharynx. Rinse catheter and tubing by suctioning saline through. Remove gloves by holding catheter with dominant hand and pulling glove off inside out. Catheter will remain coiled inside the glove. Pull other glove off inside out. Dispose of intrash receptacle. Contains client secretions inside gloves to reduce transmission of microorganisms. Turn off suction device. Assist client to comfortable position. Offer assistance with oral and nasal hygiene. Replace oxygen device if used. Wash your hands to prevent the transfer of microorganisms.